Being able to articulate stories and case studies effectively means that you can then communicate the actual benefits of what you're doing, not just the science behind it, but actually the real world stories.
So we're joined today by Steve Barnett and Dr. Mark Ratnarajah from C2-Ai. C2-Ai has been a now long-standing client of Highland Marketing, and we've worked with the company to help to really tell the story of a very important piece of technology that's been helping to address unmet need in the NHS around everything from elective waiting lists to more.
I'm Steve Barnett. My role in C2-Ai is to look after UK and international marketing. And I've been the prime contact with Highland Marketing since the beginning of our relationship, which has developed well over the last few years.
I'm Mark Ratnarajah. I'm Managing Director at C2-Ai, working alongside Steve. I'm also a practicing paediatrician. I've gone a very steep learning curve, having developed the relationship with Highland Marketing around the best use of public relations and marketing in the context of the work that we've been doing to support the NHS and healthcare providers, both here in the UK and internationally.
Steve, we started working with you several years ago, and at that point C2-Ai was focused very much on measuring things that were difficult to measure in hospitals, helping hospitals to understand where they were performing well, but also to understand any areas of concern early and to use AI in creative ways to understand risks. And so how important was the early stories that we told with you? I'm thinking particularly there was an example of helping to tell a story in the media of how hospitals were tackling acute kidney injury and significantly reducing that.
It was really important in those early days to actually get people to be aware that artificial intelligence is an established technology within healthcare was actually able to give really deep insights into the probability of people developing hospital-acquired conditions early in their stay within the hospital environment. The outcomes from the work were initially quite complex in the way that we presented them, but working with Highland, we were able to look at the messaging, look at the way we structured how we communicated that information, and it played very well. The use of language, the phrasing and the presentation was absolutely what was needed for that early work to build confidence and credibility.
And then the pandemic struck, COVID-19 came around, and we had lots of health tech companies willing to offer their solutions to the NHS to show them how things could be solved through technology. Of course, technology uptake was very significant, but the NHS was almost inundated, you might say, with offers of help from tech vendors. How important was it to cut through the noise, and did we help you to do that?
The concept of individual clinical risk adjustment at scale was fairly alien, because clinical risk adjustment is something that's normally done by the consultant, basically using a pen and paper and a calculator to analyse the individual. What we were able to do was to work with Highland Marketing to be able to position the story or position the truth, the message, that it was actually possible to be able to take an entire cohort of patients on the waiting list and to use our existing technology that we've developed since the late 90s to clinically risk adjust every single patient on the waiting list, but also do it in such a way that it was agile. So that new patients coming onto the wait list very quickly could be brought into the existing waiting list and prioritised on the basis of their individual clinical risk equitably with everybody else who was already waiting.
and it's now empowering a whole new way of thinking about things in terms of waiting lists from the point of view of providing the ability to prioritise patients or to support them through rehabilitation work. How important has it been, the media work that we've been doing around that? Mark, I might come to you on that.
Being able to articulate stories and case studies effectively means that you can then communicate the actual benefits of what you're doing, not just the science behind it, but actually the real world stories. Who are the net beneficiaries of it? What's the patient value? What's the value to the clinical teams in terms of time saved? And being able to articulate that in a way that people can understand and that resonates with them, such that they can sort of cast away some of the noise that's created within the marketplace is a very, very important thing to be able to do. And we found that working with Highland Marketing to create some of those stories and articulate some of those case studies meant that we could convey that message much more powerfully and in a way that people could understand. And of course, with all of these sorts of things, it's important that you get the clinical buy-in, of course. But, this is a multidisciplinary capability, and we need operational teams, we need clinical leadership, we need funders from NHS England. And so having stories that people can understand who may not necessarily be clinical but are still part of the decision-making process is vital. And so being able to kind of galvanize that thinking by using these sorts of media was really, really helpful. And often people need to hear these stories from several different places. They hear it within, national media or in sort of trade press. They hear it in terms of scientific publication. They hear it directly from us or through word of mouth. And then it seems to resonate and people can kind of buy into that because they've heard it from multiple angles, multiple different places, and therefore it resonates.
I guess part of this really is about putting your customers in the spotlight as well. So it's not just about directly promoting you as a company, but really showcasing the innovators in the NHS, those that have been willing to adopt this technology and being the first of type for it in many ways. So how have your customers responded to that? Have they been pleased to see the coverage that references them, whether that's the coverage that we've achieved in the national press that you describe, or the repeated coverage in some of the very influential trade titles that are out there?
We've come through a very dire time in the NHS's history, and there's still in amongst it. And I think for a lot of people within the NHS, all they ever see in the press are the negative, bad news stories of things going wrong, problems of funding and financing, waiting lists going up, and actually to be able to articulate a story that is a positive news story that actually showing and showcasing not only the work that we've been doing, but actually how that integrates with what the clinical teams are doing, and actually demonstrating that this is a true collaboration between multiple agencies, both from the private sector but also within the NHS, is very, very compelling. And of course, other NHS parties will listen to that if they see exemplars of good standards of care with evidence, and actually can hear the stories articulated not only from ourselves but through our NHS partners and ultimately the end beneficiaries of the patient voice. That is really compelling for people to sort of understand what the art of the possible is and actually showcase the whole pathway of care. And so that was absolutely vital and important to us, that we were able to sort of demonstrate that actually this is as much an NHS win as it is for ourselves.
One of the really important things about working with Highland has been the ability and the desire of the team to work with all of the stakeholders, not just the clinicians, but the operational people, stakeholders in the wider NHS transformation community, but also working very closely with the communications teams of our partners. The really important thing about the work that we do is that the delivery of that work is not done by us, it's done by the health service, which is why we've deliberately worked with them to showcase their work, the work that we enable through the technology that we deliver.
We've also been fortunate to help to really get your voice out there and your ideas through thought leadership, through proactive comments in the media that you've been contributing to. How valuable has that been?
It's been really useful to be part of plenary sessions and shared learning, because ultimately it is about the sharing and pooling of ideas, and being in front of fora where you have like-minded people and audiences that are receptive to those discussions is vastly important. Not only does it get the message out to the sort of right sort of decision makers, but B, you can actually have a lively and proactive debate about some of the thorny issues that we all face. And actually from that comes a great deal of learning. And actually, as part of that, you find new ways of working and opportunities to collaborate with a wider pool of like-minded people. So, this is a community. This is about creating an ecosystem. This is about finding solutions which actually may not be deliverable by one single entity, that actually it's through a collaboration of like-minded partners where the whole is greater than the sum of the parts.
How important has it been working with an agency that specialises in healthcare and health technology?
No, I think it's been absolutely critical, and probably one of the key success factors in our work in marketing and in communications over the last nearly 4 years. We spend a lot of time doing the work that we do, and sometimes we need to take a step back and have a conversation with an informed body about what's happening in the market, what's important, what are people saying, who's active, how do we reach out to those people. The health service tends to see external suppliers as other, and working with you guys has certainly helped us to go through those barriers, to develop good, strong working relationships and friendships with the people that we're dealing with.
As you say, this is about friendships, relationships. How have you found it working with the team at Highland Marketing?
With a thing called active agency, where you regularly say, have you seen this story developing? Have you seen this theme, this trend, this? Okay. Oh, yeah, so that fits into what we're doing here. How do we speak to that? How do we communicate with the people that we need to drive our business forward, and also to drive the story forward, so that we can get our systems out to do as much good in society as possible. I think that's been absolutely fundamental to the success that we've had. A piece of work will be proposed to me that's actually been developed between Highland Marketing and some of our senior clinical leaders. And that's been really inspirational, that close collaboration. I think we feel that Highland Marketing has become part of our team rather than a service provider to it. And that's probably one of the first times in my career I can actually, hand on heart, say that that's working.
Any sort of growing small company needs to surround itself with friends. And I don't mean that in a sort of sycophantic way. I mean that in the way that you trust what they say to you, and you can rely on their advice, and you collaborate in the ways that Steve talked about. But there's a synergy that exists, and we're in it together. And certainly things that Highland Marketing have supported us with, but they fundamentally understand what we're about and what we're trying to achieve. And therefore, every conversation that we have, every decision that we make is in lockstep, and it's not transactional. It's very much synergistic. And I think those sorts of relationships are very hard to come by and very hard to nurture and grow. But when you do have them, that's when great things happen.
But I think the really important thing is to work with an agency that knows the market. They know the people, they know the journalists, they know the publications, they know the sites that would be interested in a particular story, not just generally the story, but we know, sorry, this is Highland Marketing speaking, we know that this is going to be a theme that your product line fits directly into or will play into. So get yourself a PR agency that understands the market that they're in and work with them in a collaborative and collegiate manner. And as Mark was saying, make it a two-way conversation. We have insights, you have insights, we share those insights, we all move forward together.
The best relationships are ones that just find a pace and a momentum all of their own and lead on to other things that we can be doing together. The relationship that we have developed and then continue to develop and long may continue.